Teresa Snow separates fact from fiction.
Focus on Your Health is sponsored by MU Healthcare.
Joining me now is Dr. Stevan Whitt. He's the Chief Clinical Officer here at MU Healthcare and an infectious disease specialist. Thanks for joining us.
Thank you for having me.
Tell me, who is at risk for the COVID-19 coronavirus?
Well, we're all at risk of catching it because it's not really in the population, but the people who are at risk for more severe disease are people with severe diabetes, elderly people, people with immunosuppressive disorders, people who have pre-existing conditions.
And we're at risk for the flu or any virus, this being one of them.
That's absolutely correct.
Can you compare the two and their impact here in mid-Missouri?
Well, the flu is also a dangerous virus. Lots of people get severely ill with influenza each year. We think that SARS-CoV-2 is very similar. We think that it causes severe disease in some individuals. But for the most part, it feels like the flu. You have a fever, you feel crummy, you eat and drink and stay home and you get better.
Panic because it's new? Is that why you think it's gotten so much attention?
Two reasons. One is it's new and novel, but the second is initially only very sick people came to medical attention, so it misrepresented how severe the disease was, and we scientists thought that it might be terribly virulent. Turns out with more evidence that it's not as scary as we first thought.
More people have it and more people are getting over it.
More people have it and never would have even gone to medical attention.
So who would you test?
People who are at risk, either people who are at risk for severe outcomes from the virus or people who've been exposed.
So that might be someone who traveled to these areas that have cases.
That's a good example.
Who should wear a mask?
Masks are for people who are sick. So it keeps you from, when you cough and sneeze, it catches that and keeps you from giving it, from throwing it out in the atmosphere. It does not really protect the wearer because you breathe around the edges of those because they're not airtight and they're not virus-sized filters.
No reason to have one unless you're sick.
That's correct.
Okay, tell me what MU Healthcare is doing to prepare staff for a case of coronavirus.
This is nothing new. We've been preparing our staff for well over a decade for H1N1 pandemic, for Ebola, for this. We know how to protect ourselves. We wear precautions such as gloves. We wash our hands frequently. We wear respiratory equipment when we need to. For the most part, our primary goal, though, is to take care of sick people.
We're glad you're here. Thank you very much, Dr. Stevan Whitt.
Thank you.
And with Focus on Your Health, I'm Teresa Snow.
Focus on Your Health has been sponsored by MU Healthcare.
And still ahead, it's a Tupperware party like no other.
We're going to tell you what it is and why the kids may want to stay at home. That's